Let's listen to an expert doctor, Khadija Z Challawala, MD Cardio Physician from RK Hospital, Mumbai, for hyperextension in young population along with coronary artery disease and higher heart rate. Can be sure of happy heart?
Hi, I'm Dr. Khadija Z Challawala from Santa Cruz. I'm a leading physician, a diabetologist, cardiologist and an echographer in Santa Cruz, and I've been practicing from 20 years. And I have a lot of experience of blood pressure treatment with diabetes, thyroid, and I'm practicing in hospitals in Santa Cruz like Mangal, Sarla, Benz, RK Hospital, Mahavir Hospital on the list.
Doctor, how do we define hypertension and when should we conclude that the person has hypertension?
Look, nowadays the normal BP parameters are around 130/80. Okay, that is the ideal BP that we are seeing. But 140/80 also we can accept. But if the patient's BP is more than 150, 90, young age, according to little age modifications also we can do. If the patient's age is more than little bit, we can permit 140, 150 also as a baseline. But for a young patient, baseline is going to be 130/80. That is the ideal BP. But if the patient is having no symptoms and has no problems and the BP is like 140/90, then we try to first do it with lifestyle modifications. So then that's why we consider his baseline as 130/80, but ups and downs we can consider with the consulting your doctor. Okay, so we have to be under regular checkup of BP.
Doctor, what is the relevance of heart rate in hypertension?
Usually when patients we are seeing with high BP, their heart rate is a little high due to increased sympathetic activity. So we would like to control the heart rate with either the medicine. If the heart rate is very high and the patient has BP, then we would like to control it with the BP medicine. But if there is a BP is normal but still the heart rate is high, then we would like to do an ECG for the patient. And if the ECG is normal, then we would go for lifestyle modification like yoga and meditation to get it down. But we have to be under monitoring. Because a high heart rate means your heart is working at a higher level and the chances of complications of blood pressure or any heart problem is more in these patients. So that's why we try to get it to normal level. But depending on patient to patient, you have to consult a doctor, and with the help of a doctor, they can tell you whether this is a normal, means how to get it down.
Doctor, what precautions should a patient take along with medications?
Along with medication, the first thing we tell the patient is that take your medication on time and be regular about it. Not that when you get a headache, you take the pill of BP, So it has to be regular. And we give you lifestyle modifications like low salt in diet, which helps to reduce the BP. Then a healthy lifestyle of walking and doing exercise minimum 5 times a week, to go for a walk or any aerobic exercises which help, and doing yoga and meditation and all will also help to calm you down and get the BP down along with the medicine, and to decrease your stress levels of course, and try to change your eating habits of processed foods and foods which have a lot of sodium in their diet.
Thank you, Doctor. Public Awareness Initiative by Glenmark Pharmaceuticals.